Guys, welcome to our webinar on building strength, why muscle matters. Women's lifelong vitality. I'm excited to welcome Allyson Cabot here, and we are both going to co-lead this webinar, and then we have a bunch of questions for you that we will ask you after a brief kind of opening and overview from me. Can you go to the next slide, Alyssa? So as people are joining, if you have any questions, we got some great questions ahead of time. If you have any other questions, please drop them in the chat. After we address the questions we got online, we'll address the ones in the chat. Especially if you have questions, you could just wait till the end and we can ask of either of us, and especially for her, or if you have questions that you don't think were fully answered, please ask again. Next slide. Awesome. So I'm going to introduce myself and just really talk about why this is so important to me. I see a lot of women above 35 to their 90s, and a lot of them are doing activities to avoid wrinkles and for external beauty, which is fine, but really aging gracefully is about preserving your muscle. So muscle is your engine for metabolism, energy, and independence. If you want to age with strength, clarity, and vitality, don't lose muscle. And that's why we have this really important guest here today. So as most of you should know, or if you don't, my name is Shilpa Sayana. I'm a board-certified internist, functional medicine doctor, and certified in obesity medicine, and we practice in Sherman Oaks. And Allyson, can you introduce yourself?
My name is Allyson Cabot. I'm the owner of Core Conditioning, which is a physical therapy facility. I'm a physical therapist, and we also have fitness instructors there as well. And we primarily see women between the age of 30 to 70 as our primary demographics. And we utilize different types of equipment that is more, I would say, conducive to women so that they can build strength, but it feels good and it's something they enjoy, and so they want to continue on with it. And a lot of exercise can be depleting for women, and we have found great sources of exercise that women are happy to continue on and to develop strength at any age.
Awesome. And I met Allyson through last year. I actually had an injured my elbow through a fall, and she was critical in terms of helping me heal. And I still go to her center and do the Pilates, which I feel has been really essential in my own strengthening of muscle. So happy to have her here today.
Thanks for having me.
Sure, next slide. So I just want to talk about some conventional medicine causes for muscle loss. Aging is what lots of doctors say, but what is aging? Muscle cells become less efficient, mainly in producing protein, more prone to breakdown. Inactivity, lack of physical activity, just leads to your muscle shrinking if you're not using it repetitively. Malnutrition, not getting enough protein, or having other essential nutrients that contribute to muscle loss. Chronic diseases such as cancer, diabetes, heart disease, all can cause muscle wasting. And certain medications, specifically corticosteroids, can suppress muscle growth. And then I want to talk about some functional reasons for muscle loss. And so taking steroids is one way of increasing your cortisol, but a second way of increasing your cortisol is constantly living in high cortisol states, which all of you who've been patients here know we check your cortisol all the time. And that could be due to high stress, high anxiety, chronic inflammation, or chronic pain can make your cortisol go high and do the same thing that if you were taking a bunch of steroids for another medical condition. High levels of toxins, again, for those of you who don't know us, functional medicine is medicine where we look at the root cause. So we do conventional internal medicine and functional medicine looking for the why of why somebody's going through what they're going through at this specific time. And a common cause of muscle loss is something called oxidative stress, which is inflammation at a cellular level. And if your cells are that inflamed, and common causes can be heavy metals. Things I think the most is mercury due to our high intake of sushi in LA. And the second one is mold. And we don't think we have mold in LA, but there's actually quite a bit of mold in homes. And then persistent organic pollutants. LA was considered the most polluted city before January, before the fires. And especially after, if you are sensitive genetically to toxins and can't detoxify, you may have a toxin issue that's causing oxidative stress and causing you to have muscle loss. And then poor gut health. In functional medicine, we're all about the gut. If your gut's inflamed with the wrong bacteria in your gut, or your gut lining is not nice and tight and it's leaky, this contributes to poor nutrient absorption. And so you can't absorb all the protein you're taking in, or you're taking a bunch of supplements, but you're just making expensive poop because you're not absorbing it. So improving your gut health can really help with helping increase muscle mass. And then the last thing is lack of estrogen and testosterone. And we treat a lot of women in premenopause, perimenopause, menopause, and beyond. If you don't have these hormones, you will naturally end up being sarcopenic. And sarcopenia, again, is this loss of muscle mass. Next slide, Alyssa. So my biggest recommendation to everybody listening is test, don't guess. Obviously, if you feel strong and you are feeling optimal, then you don't need to test. Just make sure you're testing as you age, because as you age, your bones get weaker and you might be dumping toxins into your system, or as you age, you just naturally might be losing muscle. And your goal of body fat ideally should be less than 27% and as much muscle as you can get. Also, another thing that's important to test is hormones, inflammation, and toxic burden. Next slide. And this is just an example of things you can do to test. This is our BIA machine, which measures body fat and measures percent muscle mass. This is one of a friend of mine's, her BIA. And the goal is to have your percent body fat ideally less than 27%. And some people shoot for 20%, which is amazing. My only concern with that is if body fat goes too low, you might impact your hormones and you might impact your nutrition. But that's what our goal is. So test, don't guess, see how much, especially if you're going on a weight loss journey with the new medications, the GLP-1s, which I'm a big fan of from the right situation. You might lose 30 pounds, but if you've lost 28 pounds of muscle and just a couple pounds of fat, or 10 or 15 pounds of muscle, then you haven't done yourself a favor. So it's really important to preserve muscle and test when you're on those kind of injectables. Next slide. So this is our functional medicine kind of iceberg theory. If you think about an iceberg in the ocean, the tip of the iceberg is what you get in conventional medicine, which is more physical and wellness labs or symptom-based testing, but you really have to look at root cause testing, like what are your hormones, what's your gut health, what any signs of infection, any signs of toxins, so you understand your whole body, especially if you're thinking of hormone replacement. So you want your liver to really be ready for any prescription medications, and you want your body to be able to receive them well. Really make sure as you're exercising or thinking of going to an exercise program, make sure your body can tolerate something like that. Next slide. So this is just based on a question I wanted to really answer. It was, what is our diet recommendations? So I have my obesity medicine boards, and in that one, it's really about how much protein are you getting? Are you staying hydrated and having a low sugar diet? And so for the protein, what's recommended is 1 to 2 grams of protein per kg. So for about a woman who's 150 pounds, she would really need between 80 and 130 grams of protein. And that number is a big shock for many patients. They're like, I don't think I'm getting that. And they count their protein and they realize they're only getting around 30 to 40 grams a day. So it's super important because protein keeps you full. Protein really helps you create muscle. And so it's such an important nutrient to make sure you're getting enough of. And we have a lot of vegan, vegetarian patients. Even for those patients, you have to really aim for these numbers. Staying hydrated is super critical. And then really low sugar diets. I'm going to throw a quick equation out there. Your total teaspoons of sugar in a day, you want to have less than 10 teaspoons. And how I calculate that is your total carbohydrate minus fiber divided by 5. And so if you're eating a banana, it could have 6 teaspoons of sugar. If you're eating an apple, it could have 2. So berries and apples are my go-to fruits versus like tropical fruits like mango, banana, papaya. It's all those have high sugar. So try and keep your sugar content to less than 10 teaspoons, mainly because at any one time in our bloodstream, we only have 1 teaspoon of sugar floating around. And the next slide. And where can you get protein from? I think all you guys know, but it can come from things like animal protein, dairy, eggs, lots of legumes and beans have protein. And so why is, again, protein so important? So as we get into perimenopause, menopause, your estrogen levels decline And so does your testosterone levels decline, so your muscle loss is much higher. And protein again makes you fuller, it helps with blood sugar regulation. And so we try and space your protein out throughout the day. A lot of people just trying to get as much protein as they can in one sitting. That would be very difficult because you feel super full. Next slide. So now we're gonna ask, if you have any questions, you can throw them in the chat and I will see them here. And then we're gonna ask Allyson some questions.
Okay.
Okay,
Let's
some
go.
questions people just asked beforehand. And so one of our listeners wanted to know, what's the best resistance / strength exercises for someone who has limited mobility or lives in chronic pain?
So firstly, I just wanna say, there's so many different types of exercises out there, right? And so I think what's most important is finding an exercise that you enjoy. Very, very, very important, otherwise you're not gonna keep doing it. You're gonna find every excuse in the book not to go. And you don't want to be depleting your body, you wanna feel good, you wanna feel like you enjoy going, that it feels good on your body, and it's something that you want to keep doing. So I think that's most important, and there's so many different choices.
Right.
In terms of somebody who has limited mobility or who may have pain.
Yeah.
The first thing I recommend is starting with isometric exercise, where you're contracting the muscles, but you're not moving through full ranges of motion, so your joints are staying uncompromised. So, just like doing things against a wall can be very, very beneficial, like to work your scapula, you can press and do like almost like a reverse push-up against the wall. I mean, there's a tremendous amount of isometric types of exercises out there, but that's a great way to start. Super safe, and usually it does not aggravate your body. So I would recommend starting with isometrics. I am very much about alignment, positioning, having the right muscles perform the exercise. So you want the right muscles at the right time with the right amount of force. So when I work with people, I get them very aware of their postural alignment. I make sure they're engaging the right muscle before they do the exercise, and then I allow them to go through the movement pattern. And I really don't want them to go into heavy weighted types of exercise until they know where they need to be in space and what muscles should be activated. So it's very specific. And I feel like it not only improves their muscle tone, but it improves your posture, it improves your alignment, we work on breath, all of those things.
So if somebody like that comes to you, would you work with them to improve that? It sounds like you need expertise, and then it's something they can do at home?
Yeah, so I was saying that what I think is quite beneficial, and it doesn't necessarily need to be me, but finding someone who is very knowledgeable about the body. There's lots of highly educated fitness trainers out there who know a lot about the body, but you really want to find somebody who's going to look at you and know what you need based on what they see in terms of your body and your symmetry in your body and where the weaknesses and imbalances are, and developing a specific program that works for you.
So really personalizing it.
Very personalized. And I was telling Sayana, because I'm a physical therapist and I have a practice that has 8 other PTs there, we do have some people come in, and if they get a prescription from their doctor, if you have a shoulder dysfunction or hip dysfunction or chronic pain or scoliosis or any type of diagnosis. Sometimes you can just come in for a few sessions and we can teach you how to utilize your body and put you on a home exercise program, or figure out what the best exercise routine is for you.
Via insurance, you guys take
Via insurance, I personally don't, I'm a paid per service.
But there's some people who do it.
Oh yeah, we have like 6 PTs that do that, so I'm really particular and picky in terms of exercise, because I think it's so important to be doing the right things.
Makes sense.
And to not get hurt, because I treat a lot of people that get hurt from going to boot camps or to hit workouts, and it's like, oh my gosh, there's so many better ways to work on your body. And you want to be doing it for the rest of your life, so you want to find the exercise techniques that are most beneficial specifically for you, and I are different. So
Right,
what
that
you
makes
need is
sense.
different from what I need.
Completely.
Yeah.
Yeah, we do a lot of epigenetic, like genetic testing here, and sometimes we see people's genetics that don't make it, that would kind of college in. Or they respond really quickly to stress, and so maybe they won't do well in a very
Right.
intense exercise type program.
Right, like someone had a question about Ehlers, which is a
Yeah.
connective tissue disorder. How I work with someone who has Ehlers is very different from an able-bodied person, so.
And do you see a lot of people with Ehlers-Danlos
Yeah, well,
syndrome?
definitely way more because it's
Yeah.
become a much more, I don't wanna say much more
Aware.
common, there's
Yeah.
much more awareness about it now, and it's very, very difficult to get to that diagnosis.
How would you
It
treat
takes
that kind of
years
person
and years and
different?
years for people to actually get accurately diagnosed. And many, many different types of doctors before you actually get to that. So they have a lot of hypermobility, so we want to get stability in their body. They're highly flexible, they're at the end range with all of their joints. So you don't wanna work on
Yeah.
flexibility with that particular type of person,
Yeah,
you wanna work on stability.
very different.
Yeah, very different, but I like to start with stabilization exercises before I go into high movement exercises, because you wanna have core stability. And then you incorporate more of the global muscles into a routine. You want people to understand how to connect to all of their intrinsic muscles first
Mhm.
before you work out into the larger muscle groups.
Would everybody in your practice have expertise with Ehlers?
Yeah, I wouldn't say everybody, because some of the trainers might not necessarily. But the beauty of our practice is we all work in one big space, and our trainers are always working with the PTs. So they are highly knowledgeable. And if they don't know something, they can just,
So much collaboration,
yeah,
awesome,
a lot of collaboration.
that's so great,
It's lovely.
that's so nice, we have a nice team approach.
It's very, very much a
That's
team
special.
approach, yeah.
And then one person asked, that's exercise to strengthen bone, is it a weight bearing exercise?
Weight bearing, so.
So, yeah.
And
I'll
I'm
show you that.
really a huge proponent of using your own body weight. I mean, it's great to use weights and stuff, but actually using your own body weight, it's called body weight bearing exercises, like, so something like a push-up, a lunge, a squat. Where you're using your own body resistance to perform an exercise,
Okay.
has a lot more input into your system than using like a weight. Because you get the agonist, the antagonist, and the synergistic muscles all working together at one time. Versus if you're doing a weight,
Yeah.
you just get the concentric.
That's interesting, I
Yeah.
never thought of it that
Oh
way.
my gosh, so much better to use full body weight and your own body weight. So there's so much you can do without even
Yeah, it
having
sounds like
equipment.
That's great.
Yeah. But I do like equipment. We have lots of good
Yeah,
equipment.
you have lots of good equipment, tell us
Yes.
about some of that equipment, I've seen things like hanging from your seat.
Yeah, so yes, so that's a system called Red Cord, which is from Norway. And that is all closed kinetic chain or body weight bearing exercise.
Okay.
So it's highly, highly impactful, and it works in all different planes of movement. It gets that agonist, antagonist, synergistic muscles all working at the same time. And because I work with a lot of people that are injured, I'm able to offload some of the weight of either their trunk or their extremity, and I can really just focus on a particular muscle that I need to activate.
Great.
I can bias a muscle, I can't just work one muscle, because we don't work like that, we work in chains of muscles, but I can bias specific muscle groups. So that I can get the muscle that's not firing to fire without all the bigger muscles trying to compensate for it.
And you see a lot of change as you work with people?
I can see people who've had back pain for like 15 years, sometimes I work on them once and it's.
Wow, that's amazing.
It's not about the strength, it's about changing the brain to muscle connection.
That makes
Because when
sense.
you have an injury.
Yeah.
Your body tells the brain tells the muscles shut off, I don't wanna cause more pain. And until you specifically reboot that computer, that
You
connection.
rewire your whole system.
You have to just reconnect the wiring. And so people can go for years and years and years without having that connection, and you can in one session reconnect that.
That's amazing.
That doesn't always happen.
Right,
But I've
That's
seen
good.
it happen.
that's amazing.
Yeah.
Yeah.
Yeah, and so that type of weight bearing exercise in
Yeah.
the ropes, cause you're suspended and the ropes are dynamic, you get a lot of input into your system. So red cord is one thing we do. We have a full Pilates studio, which Pilates is amazing. I love it as an exercise technique. I mean,
And you have so many options for Pilates that you could come with your 3 girlfriends and do a class at
yes, you
4.
can do classes, you can do duos, you can do
Couples, yeah.
privates, you can do mat
That's so
work,
great.
and there's many different types of pieces of Pilates equipment. And then we have something called Coraline, which is, have you been on the Coraline?
No, what is that?
It's the, well, we won't go on that,
But
but
it's
I'm
not-
sure you've been on it,
Maybe
you
I
thought it
haven't.
was Pilates, but it's
But it
not.
wasn't.
No,
Oh,
cause
okay,
it is wood and it looks
Yes,
kind of
yes,
like,
I've been on that.
okay, yeah, so that's pretty amazing, cause it's upright strengthening and you can mimic gait patterning, walking and push-ups and. Yeah, and then we have gyrotonic, I mean, we have tons.
Yeah.
But
that's
it's
amazing.
not your conventional type of exercise, it's more, I would say full body experience.
That's
Not
great.
just working your bicep, but working your bicep, but your core is working and your alignment's right and it's full.
That's really what you need. Supposedly by the time we're 50, we're losing 20% of our skeletal muscle.
Right,
So we really need to start this in like our 30s.
well, stuff starts in your twenties, you start to get
Yeah.
changes, after
Right.
40, it's.
No, wait, no, don't say that.
It's not down, I don't think,
Yeah.
I mean, I'm 60
Yeah.
and I work out almost every day,
Wow.
but I
So
do.
what do you do in your routine with more resistance training, more?
I do all, yeah, so I do Pilates with a trainer twice a week because I'm like everybody else, I want someone to tell me what to do.
No, to show up.
I do red cord with a trainer once a week and I spin twice a week. So with women, you want to be doing some sort of strength training at least twice a week.
Okay,
And you wanna do cardio at least
like
7.
an hour twice a week?
Yeah, 30 minutes to an hour, I mean, start with 30 and build up.
Okay.
And then with cardio, you wanna do at least 75 minutes a week. And that can be, you know, for some people, they're not gonna be able to spin, it's too
Yeah.
intense, and that's fine. I walk my dog, I get a dog, get a pet.
That's your advice, that's true, it helps with so many hormones.
If you get nothing from this, get a dog.
Get a dog.
Because you have to go walk them.
Yeah.
So I walk my dog with my sister. I always have I don't have any workouts except for spinning, which is in a group class,
Yeah.
so that's not alone, but
Wow.
I'm always held accountable.
So that's
by
true,
somebody.
being held accountable is
Yes,
critical.
so I always am working out with somebody. I have to be held accountable.
That's so great, I think there's so much community when it comes, I think everyone knows each other and that's so important.
Yeah, and the other thing I have to say is that if I don't work out,
Yeah.
that's my de-stressor. Like, if I don't get, and it's so great for you emotionally too, it's not just the physicality.
Yeah.
Emotionally, it's just, you know, it's a de-stressor, anti-anxiety, the hormones that
Yeah.
it releases that, you know.
Absolutely. No, you
All
need
of
to have
that,
those times, and do it
yes.
safely.
And
Every
take
time
time for yourself, you know, most women are taking
not.
care of so many people, even if you don't have kids or pets, you're working or you're taking care of a home
Yeah,
or
or your elderly
children,
parents.
or yeah,
Yeah.
it's
so
a
true that my
lot.
first Pilates time was like, I can't focus on anything else because I have to focus.
Yes,
so
it's a moving meditation.
Yeah.
The exercise,
That's
yeah.
well said. Amazing. So I have another question, is more specific questions, it's if somebody has Parkinson's with scoliosis, sounds like, I guess some of the stuff you already said, what could they do?
Yeah, but like scoliosis is very specific, right? Because
Yeah.
you have curvature in the spine, so you want to lengthen the sides that are compressed and tight and strengthen. Cause tight also means weak. A lot of people think
Yeah,
if it's
tight,
tight,
strong.
it's strong. No,
Wow.
because the muscle fibers can't glide and slide.
So you really need to have more flexible.
You need to be, you
More
need
active
to lengthen, tighten muscles, you just need to strengthen, tighten muscles. And you wouldn't necessarily always work symmetrically, like you might need to do more repetitions in one direction and the other if you
Yeah.
tend to not move in that direction.
So you really have to work with an expert.
Initially, just so you know what to do, yeah, and also with Parkinson's, a lot of balance work.
Yes, so yeah, without having muscle strength, it's hard to have balance.
Yes, you need to really do a lot of balancing work, and also for females, they tend to have more balance issues than men. So
That
a lot of
makes sense.
balance work. So we're talking about strengthening, which people usually think of like strengthening is muscle strengthening, which we absolutely need.
Yeah,
But you need cardiopulmonary strengthening, that's where the cardio comes in. We need balance training, we need flexibility, we need strengthening. It's not just strength, you need strength, flexibility,
so true.
balance, cardiopulmonary.
I think
work.
to add to that, a lot of women, maybe closer to 40, but definitely after 40, their pelvic girdle is just weaker, you need to go to the bathroom right now.
Yeah.
And I think Pilates that way seems to help a lot of women, specifically on the pelvis.
Yeah, it works on the pelvic floor and the
Yeah.
core, and those two areas of musculature are very closely related. If you engage your inner thighs, it causes your pelvic floor to engage, and then your abdominals are facilitated. So that's kind of the whole core, is the pelvic floor is part of the core.
Yeah, a lot of women are like, what medication should I use? And I was like, well, how much are you exercising in the area? A lot of people are walking. Walking is like their main exercise. So for somebody who's listening, who's just a walker, what would be the first thing you would say, start to try to do in terms of resistance training?
Yeah, I think starting with isometrics or even like resistance bands, resistance bands are amazing.
Yeah.
Yeah, and you can get them on,
Yeah.
I'm gonna say
Amazon,
Amazon, can
yeah.
I say that?
Yeah, you can.
Okay.
You can. Yes, no, yeah.
You have to be so
You have to
careful,
be
right?
careful, yeah.
You can get them probably at Target
Target,
too,
yeah.
there you go. So, any like resistance tubing
Yeah.
exercises are great, and you
Okay.
like, especially for travel and stuff, to have a TheraBand or elastic bands, you could do a whole routine, you can do an hour, more than an hour.
How do you stay disciplined? You said accountability and you just don't feel good if you don't exercise.
Yeah, and I've just always been a mover.
It's how
I
you
was
can.
very fortunate, it's not like I was like, okay, I need to start exercising,
Yeah.
like. I played volleyball, I wasn't like a star athlete or anything, and I started moving then, and I just never.
You're always active.
I'm very lucky in that I really enjoy it, for me, it's.
So that's what the enjoyment
enjoyable.
piece is so important.
Yeah, that's why you need to find
Yeah.
exercise that you like,
Makes total sense.
you don't wanna be
Yeah.
beating yourself
And
up.
dancing, like, just be out there.
Great, yeah, it doesn't have to be like you're going to a class, yeah, you can go dancing, you can go ice skate, maybe not ice skating. Especially if you're osteoporotic, but
But just something fun.
rollerblading, just anything, going out on a walk with your friends, I'm a hiker, so that's like a big passion of mine, find what you like.
Absolutely. I have a lot of women who take like low dose testosterone hormone replacement and they're like, my muscle's not increasing, but I'm like, you're not moving your muscle. It's not going to increase,
Right.
no matter how much testosterone they give you.
Yeah, you gotta move it,
You gotta move
use it or lose it.
Exactly.
It's definitely true, and it's not just about the muscle, it's about if you're not moving, you're not getting the brain to muscle connection either, so we want to keep our brains going as well. And
Exactly.
movement helps with that, actually.
Absolutely, and movement and stretching just by itself naturally reduces your CRP, which is inflammation. So moving and stretching is so important. With one more patient-specific question about how going through something specific. Mitral valve prolapse, if somebody has that specifically, any recommendations of how to start?
Yeah, so I'm not sure if everybody knows what mitral
Valve prolapse, yeah.
prolapse is. So on the left side of your heart, you have the atrium up top and the ventricle on the bottom, and there's a valve where the blood flows from one to the other. And with someone with a prolapse, there's a problem with the valve, so sometimes the blood flows up instead of going down. And so it's not usually life-threatening, and sometimes there's operative procedures that take place, but most people can
Function
do
without,
fine.
yeah.
But first of all, if anyone has any medical conditions you're gonna take on some sort of exercise, definitely speak to your physician about it.
Absolutely.
Most importantly, and let them know what your thought is, and they probably might have some recommendations. But you don't wanna do high impact aerobic activity with that type of diagnosis. So either low or moderate physical activity, cardio, so swimming is great. Walking is great, biking, not necessarily spinning, because that's more high impact. And then just really monitoring your symptoms, like do you have dizziness, shortness of breath, things of that sort. But low to moderate impact aerobics is great.
Makes sense. And then how many times a week should a long distance or half marathon and lift weights? Boot camp classes, good workouts to build strength.
Yeah, So again, when you're doing strength training twice a week is great, between 30 and 60 minutes, depending on if you're a beginner or more advanced.
Yeah.
I'm not a huge proponent of boot camps, I have to
You
say.
just said whole body muscle.
I'm like
yeah.
very much like, make sure you're in proper form and the right muscles are working and you're not like,
Yeah.
lifting weights in your upper traps or in your ears and your neck is compromised.
That makes sense. That was
So
like the rest
if
of
you're
the
very aware of how your body needs to be in space and what muscles you need to be contracting, then go for it if you can. But if you're just starting,
I wouldn't recommend either. And I think that ties into this next question. It says, how can I do this exercise when my body gets super stressed with exercise? And we see this a lot in people who have high cortisol. Like they're stressed or they're anxious or they're inflamed and their cortisol is already high. Now you're gonna add
or
more
people like who
stress.
have chronic fatigue or fibromyalgia and stuff. So you want to find types of exercise that are gentler.
Right.
But you're still moving, like yoga, tai chi, Pilates is great, Coraline, things where you're moving, but you don't feel like you're being taxed and compressed and fatigue and make sure you rest too.
Yeah, that makes
Rest
sense.
is very important as well.
Rest, exactly, rest and recovery for sure.
Right.
And maybe doing exercise, thinking about getting enough protein around that exercise time or taking creatine, something to really help.
And your breath, make sure you're breathing. It's very important to
I
breathe.
think a lot of us are just holding our breath.
Yes, it's challenging times right now, so a lot of breath holding.
Yeah, the breath holding.
Go in your closet and scream for a little while.
Somebody asked, what are your thoughts on a mega former?
Okay, that's a type of reformer,
Yeah.
yeah, so I'm a very traditionalist, like, I work for Balanced Body, so I only work on Balanced Body reformers. I need more clarity on what that is. Do they use like a lot heavier spring tension and are they doing upper body and lower body at the same time?
Heard the questions asked that as to what exactly the mega former is, but do you like the reformer in general?
I love it. I mean,
How about your thoughts on the power plate?
great. The vibration plates, yeah, those are great to use. Gives your body a lot of proprioceptive input, the muscles get connected. Like doing squats and things on a power plate are great.
How about things like OsteoStrong?
Great, yes, now, it's really, really good, and I have clients that go there.
Have you seen improvement?
Yeah, well, they have in their
They
bone
have.
scans,
Okay.
they feel like they're not doing anything.
Yeah,
So
a lot
they
of people
don't
feel that
feel,
way.
they don't feel like it's exercise.
Cause it's like a little bit of weight.
Yeah.
Yeah,
So it's great for bone,
but not
but
for muscles.
not for muscle,
Yeah, and that makes sense, like so much of the data as I was researching for today's talk is all about bone.
yeah.
And very little about muscle, and if it's about muscle, it's all in men, and men and testosterone use, so it's so limited.
And you need, actually, the pull of the muscle
Yeah.
makes the bone stronger.
Exactly.
So if you can find exercises that get the muscle and the bone.
Yeah, then that's win-win.
Yeah,
That
and
makes sense.
I like strong for the bone thing, but it doesn't feel like exercise. If you wanna exercise and feel it, you're not gonna
I
get
think a lot of
that.
people have felt that way.
Yeah.
Because I think it's really one bone.
It is, but it's good. I'm not saying it's not good. It's great for osteoporosis.
Yeah, that's great. And then another question, perimenopausal, menopausal women are encouraged to lift heavy weights. How heavy without injury or straining my back? I think you kind of answered
I don't
this.
think it has to be heavy, like what I said about using your own body weight.
Yeah.
You're gonna get the most bang for your buck with the most muscles activated, which is then gonna help with the bone.
That makes sense.
Yeah.
And then another big thing we see in the whole perimenopause, menopause age is really like frozen shoulders and the lack of estrogen, so the lack of lubrication. So just be careful before starting an exercise program that you are evaluated fully and are ready to begin something like that. Perfect. Any other questions? If there's any other questions, please drop them in the chat. Just want to make sure I answered all these questions. Well, you answered all these questions.
I may or may not have, I'm not sure.
No, I think you have. That's great. And then have you seen women who are fit and active well into their 80s and 90s?
Oh, yeah,
What do you think their
amazing,
secret is?
staying
Consistency.
active, they stay active and mobile. Yeah,
Yeah, it's just like we're losing muscle anyway, so many of us are just sitting.
well,
Like sitting
think
jobs.
about things have changed with the computer.
Right.
I mean, I'm so happy I don't have to sit at a computer. My job is very active. I work on like 6 or 7 people a day.
So you're constantly
Working on the equipment,
Yeah.
working on their bodies. I don't sit at a desk. I never sit at a desk.
That's you're lucky. I think so many of my patients sit at desks like 8 hours, 9 hours a day.
Most of my
Yeah.
patients come in with postural dysfunction, or it's because they're sedentary that they're having issues.
What do you think of those, it's like a brace that pushes
Oh,
the posture back? Yeah,
I think
posture
that's very good.
brace. So I think
Yeah.
you recommend people.
I do, but you can't just wear that, you have to wear that and do specific exercises too.
Not just with the head.
It's
right?
more of a feedback, so you're aware, but then you need to strengthen your own muscles, so you don't need the vest anymore.
Okay, so that should be your goal, not to just hang out in the.
Correct, but better to have the vest than no vest at all.
Okay, great.
Yeah, because it is very, very proprioceptively, makes you aware of how you are sitting or standing or walking, so.
And then what do you think of those like ankle weights and weights in general?
I'm not a big proponent
Okay.
of wearing extra weights.
Like the stuff you can wear with
Yeah,
hiking,
yes,
if you're wearing
I-
heavy things, Yeah.
It just pulls on your joints.
because it's kind of painful.
Yeah, I'm not a proponent of that, but that's just me personally, it's not based on anything other than I don't think it's a good idea.
I think it's listening to your body, if it's hurting you.
Yeah,
don't do
I
it.
mean, if you're gonna wanna do strength training, then go do strength training and then do your cardio separate. I mean, it's okay, like in my spinning class, we'll sometimes do weight training
Yeah.
things, but the whole thing isn't like holding a weight while you're
Just
just.
demanding that.
Yeah, it's, I don't know.
Makes sense. Good. I think a lot of people ask that question.
But that's my opinion, that's not necessarily based on like a research article of what is good and not good.
But yeah, I think getting out there, finding something you love to do and doing that consistently makes the most sense.
Yeah, and do things that you like. That feel good, that make you feel good.
Yeah, I was just telling Allyson before about how the biggest rate of suicide in women is between age 45 and 55. And we just that statistic is really alarming to me, and this is an age demographic that both of us see.
Yeah, the most of our patients are in that range, and we were talking about why we think that might be.
Yeah, so many reasons.
You know, yeah, you're, if you have children, they're leaving the home, or if you have parents that are still alive, you're generally having to deal with your aging parents.
Yeah.
Or you have a lot of stress at work, and if you did have kids, they leave the home and you're losing your identity or not knowing where you are in the world.
Exactly.
So-
What's your purpose? So I think, and that in the
And
background.
pressure, so much
Yeah.
pressure on women to be a
Yeah.
certain way.
Yeah. And some of my patients, like, I kind of hit the I hit the peak of my career, and is this it? And I like, what is my purpose?
Why
Yeah.
did
Why did I do this?
Why did I do this?
Yeah, to make sure.
I love my job, and I'm sure you
Yeah,
love
I
your job.
really do.
Yeah, I get to
Yeah.
help people all day. It's a my sister, I have a twin sister.
Yeah.
And she's in sales, and she has so much stress, and no one's like. Every day people are like, thank you so much, like,
Yeah, no,
You're
I'm
helping
completely so
people.
grateful for the kind of
Yeah.
work you do.
I mean, it's just very rewarding.
And those, your sister, the cortisol spikes, each time there's a
Mhm.
cortisol spike, she has less muscle.
Right.
So it's so important to protect your cortisol.
Yeah, and the stress, and
Yeah.
it's just not gratifying,
For
I'm
sure.
very grateful for my job.
And then from 45 to 55, if you're in that age decade, I think exercise is so good, especially if you can go with others or see others. It's a sense of community, I think that can be really missing.
Yeah, and as people get older, that's really
Yeah.
difficult, they start to get depression, and they have, they're not interacting with people, and also things start to change with your hearing and your vision and all of those
Right.
things, and it
It's all
impacts
different.
how you are in the world.
That's
So getting out there, moving, getting to be around people, all of that's so important.
super important. Any other questions? Oh, no, there's one more question. You mentioned creatine helping with cortisol. No, creatine helps with muscle building, so it's a good thing to take creatine monohydrate right after exercise. It can help with muscle repair and muscle building. But things to lower cortisol would be, my favorite supplement is Cortisol Manager. You can get it anywhere. Integrative Therapeutics, it just has a blend of ashwagandha, cordyceps, phosphatidylserine, things that just naturally bring down your cortisol. But I think just check your cortisol. Sometimes you may not know if you've just been running because of life all the time, your cortisol may be actually very low and you need something to like gently bring it up. But if you're in stage 1 or early cortisol spikes or something just happened at work, you may have a hard time sleeping and you may be awake between 3 and 5. And that's when cortisol manager can help. But the question is, if you're in your 40s and 50s, is it a lack of progesterone? So definitely check your hormones, not only cortisol, thyroid, and your sex hormones, so you can understand the relationship between each. And how I describe it is like a relationship between family generations. Think of your stress hormones, which come from your adrenal glands, as the wise grandmother, and your thyroid as the supporting mom, and your ovaries as the sensitive grandchild. And she's going to be very sensitive to generational stress from your adrenals to the thyroid. So check the whole cascade of hormones, so you can kind of see where the missing link is and which hormone you should really look at. And in my experience, if you can address the wise grandma, which is the cortisol, everything else kind of falls into line. So check and see, and obviously ask your own primary care, but if you find functional medicine doctors is an easy person to look at, a naturopath, and try, and when you actually start wanting to be active and moving, make sure your cortisol is balanced, especially if you feel like exercise hurts you. Then are you doing the right exercise? And meet with an expert so you can get an evaluation, say, this is what I like, this is what I don't. What would you recommend?
And cortisol is a blood test, that's how you determine.
Yeah, so there's a bunch of ways you can do it. So popular ways are the Dutch test, which some of you may have heard of, which is a salivary test. You measure your cortisol and your sex hormones. It's a nice test, but it's $400 each time. So, but the cortisol test through Quest is $8. And you can do your cortisol, it just has to be in the morning before 10 a.m. And you want to not exercise that morning. And so you can just check your cortisol and see where you are. The range is 4 to 20. Again, that's the difference between conventional medicine and functional medicine. Conventional medicine, if you are 4.2, it's normal. But in functional medicine, you want to be optimal. So a good morning cortisol is between 10 and 14. And again, if you went to me as an internist before functional medicine, I would say that's normal if it's 4.2 or 20. But you really want all these labs to be optimal, and that's really the difference between functional medicine and conventional medicine. So yeah, check your hormones, make sure you know what who you are before starting an exercise program, and just go slowly, like she's saying. Well, weighted vests. Are they safe? We talked about that.
Yeah, I mean, if you have maintained postural integrity and wear it's safe. But if you're flex and then putting weight on top of that, that's not.
Yeah, so posture, it's all about posture.
Posture and engaging the right muscles and having the right alignment. Yeah.
And then how heavy, I guess really what you can tolerate and go slow.
Yes.
Best thing to eat before and after workouts, do you have a favorite?
I'm not the expert in that, so I do not know.
So biggest thing is protein.
Yeah,
A lot of people
of
just
course.
kind of like skip breakfast and show up for exercise. Make sure you're eating enough protein. Your goal really should be at least 60 grams. And this is my vegetarian vegan patients really struggle with that number. You can get it from legumes, eggs if you eat them, cheese if you eat it, or really sometimes you have to rely a bit on protein powders. But if you're conscious, things like hemp, teaspoons of hemp, or making sure that you are incorporating some sort of bean. The best thing about bean is also a natural detox because it has so much fiber. And if you guys haven't heard of the bean diet, there's something called a bean diet, which is actually a diet for detoxification. So if you can tolerate beans and your stomach doesn't mind them, I would highly recommend that. And the benefits of berberine by one last patient. So berberine is a bark and it is used to help drop your insulin. So it'd be really great to help you with controlling your blood sugar. It's also a natural antibiotic and antifungal. So it's a great supplement. We have a lot of patients take it. I would just say start slow. A lot of companies have a 500 milligram dose available. Start at 250. Make sure you always take it with food. So many patients again are like, I didn't eat, I just took my berberine, I felt dizzy. So take it with food. There was a big trend last year on social media saying berberine is like the new, or is the old GLP-1. In terms like Ozempic or tirzepatide or Mounjaro, but it works by dropping insulin. It works in a very different way than those medications, but it's a safe supplement to take and even take long term. That being said, some people can have side effects, especially if you have a lot of gut inflammation. You can have nausea and abdominal pain. I think somebody asked a question about Emzella and Emsculpt. So I'm a huge fan of Emzella. Emzella is that machine, it looks like a toilet, you sit on it, but it's a seat, and it does, I think, 10,000 Kegel exercises in 30 minutes.
Oh, really? I don't
It's
even know
fabulous.
about this.
I've taken my mom a few times to get it done.
It's you go to a facility.
You go to facility, so it's not covered by insurance, it's usually like at a med spa, or I think within our 5 mile radius, we have 4 places that do it.
Oh,
It can be expensive, I think for about 6 sessions, it's about $2,000 or 8 sessions, it's expensive. But it really does help strengthen your pelvic girdle. If you can't afford that or don't want to be in a public space doing that, there's another machine called Innovo, INNOVA, it's shorts. And you wear it and you hook yourself up to an outlet and it does about 60
so it's like
contractions.
Easton.
Yes, exactly. But the problem with the Innovo, a lot of my patients say the customer service sucks. Like when things
Are
are
you
broken.
supposed to contract when this?
No, but you have to stand.
Okay.
You have to stand, but I don't think the customer service experience, I'm kind of hesitant about recommending it. And sculpt, same concept about contracting those muscles and the skeletal muscles. If you are like super fit and you just want to see your abs more, great idea. But for most of us, we're not super fit and we do have some adipose fatty tissue to deal with, it's not going to be very effective. Remember, all of this is only effective if you do it routinely. So if you had an M-Sculpt machine at home, makes sense, but otherwise, it's expensive. I'd rather you have working with an actual expert, a physical therapist, or a trainer who's knowledgeable and do stuff consistently.
Yeah, and it's very important to activate your own musculature versus an external stimulator activating your muscle.
That's exactly this concept.
Yes, so it's not gonna be long withstanding.
Right,
You have to train your own
Yeah.
muscles to engage that way. Now, you can use Easton to facilitate your own
Right.
muscle contraction
exactly.
for those individuals that can't feel it or wanna have more input.
But it's not a solution. That's the
No,
only thing.
it's not a solution.
Excellent, deep squats on the power plate seem good for that too.
Great,
Makes sense.
yes,
It makes a
all
lot of sense.
good suggestions.
Perfect. Excellent. I just want to give one person either the choice of something to help their cortisol or something, or creatine. It's just our usual raffle that we do on these webinars. So Alyssa, pick our random participant
Exciting.
who stayed with us the entire way. We appreciate the time. We understand it's an evening and appreciate you for coming by.
Thanks, it was fun.
Yeah, and then Alyssa, can you also throw up the slide about how to, if you want to get in touch with either of us, you can work.
Yeah, if
with
anybody
that.
has any questions, feel free to email me or chat. I'm happy to answer anything else.
And then they can contact for condition.
Absolutely, yeah, if any of you guys wanna come and have a session with a therapist and
And the classes that you have on your website, they can
Yeah.
just come with people. How many is the maximum number?
we only have like 4 people in a class, so it's very
Okay.
different from most Pilates studios where they have big groups. Ours is very specific.
Okay, great. That's the information. We'll leave it up there for a minute if you guys want to do a QR code. And you guys have 2 locations.
Yes, we have one in Studio City, right on Ventura and Coldwater, and one in Burbank on Magnolia near Keystone.
Right.
In the Magnolia Park area.
Awesome. Excellent. So if you need to get a hold of, use the QR code or call, text. And there is one more slide. You need to get a hold of us. I think most of you are already our patients or have been, so no. That's a QR code. If you have any questions or questions specifically about this webinar, if you want to share the recording with any friend or somebody you think it'll be useful for, you will get an email after this, probably by tomorrow, with the webinar recording in there. Thank you all for showing up.
Thanks, everybody. Get
And-
moving.
Get moving.
Get moving.
And the lucky winner is, let's see. Gail Steinberg. Okay, Gail,
Good job, Gail.
congratulations. So you should do like the lottery now. But we will contact you and we will ship it to you. You can come by and pick it up. Take care, everybody. Be well.
Have a good night.
Bye-bye.